You're watching The Source on CNN Philippines. Metro Manila, Bulacan, Cavite, Laguna, and Rizal return to a more relaxed general community quarantine from August 19 until the end of the month. On Monday, President Rodrigo Duterte approved the recommendation of the Interagency Task Force to loosen restrictions in those areas after being placed under a strict 15-day modified enhanced community quarantine. But some experts earlier recommended another MECQ extension to avoid losing gains in the COVID-19 fight. Let's go straight to the source of the story. We have health spokesperson Maria Rosario Vergeire. Yusek Vergeire, welcome to the source. Thank you for your time.
Good morning, ma'am. Thank you also.
NCR and nearby provinces will be reverting back to GCQ beginning August 19. How is the health department preparing for this?
Yes, actually, the 2 weeks that we had for the MECQ that was implemented, we were able to recalibrate our strategies already. So first, the safeguard would be enforcing strict minimum health standards across the different areas of the country. Second would be the stricter granular lockdowns of the different local government units. So what we did for these past 2 weeks, we went to the different areas, to the different local government units. We tried guiding them and we provided them with support, both resources and technical assistance, where we were able to provide them with the guidance of doing active case surveillance. This is doing house to house, looking for those people who have symptoms, looking for those people who had been exposed and immediately isolating. We also have set new targets wherein we have to find contacts of a positive patient or maybe even just a suspect or probable within the 8 hours period that they have while they are doing the active case surveillance. Another thing that we have done was to establish the One Hospital Command. This is a strengthened referral system between and among different hospitals in the metropolis so that we will be able to accommodate patients who would be needing admissions at this time or at this point in our pandemic situation. So all of these things, we have primed the system, and eventually or hopefully in these coming weeks and days, we will be able to have a more stricter lockdowns among the different LGUs. They will be able to identify suspects, probable, and contacts of positive patients so that we can immediately isolate and test them.
Yeah, when I hear you say that localized lockdowns is nothing new, Yusek, matagal na po itong ginagawa. But I guess how you're saying this, it's a little bit a more aggressive approach into lockdowns and more aggressive contact tracing, as you were saying, and of course the establishment of this One Hospital Command. But you have the UP Octa saying that we may actually reach 230,000 cases by the end of August if we revert back to GCQ, which is what we're going to do by midnight tonight. They said if we lift the MECQ prematurely, we will need to deal with the outbreak in NCR, entering a phase of uncontrolled and very rapid growth. Must we be alarmed by a statement like this? Imagine saying uncontrolled and very rapid growth.
Yes, Pinky, we have to be clear on this. No, when institutions make their estimates, this forecast, this is based on models, this is based on assumptions. That's why we have safeguards that we would want to implement strictly so that we will not reach that certain level of numbers in the cases here in Metro Manila specifically. So this is what we are going to do. I just like to make mention also that even experts are saying it is not just community quarantine that is the only intervention for us to fight COVID-19. Also, our economic managers are already telling us that we need to look at the economic side of this all because a lot of people are going to get hungry already, and the other diseases, aside from COVID, would be evident in the future if we are not going to ease out on these restrictions and continue on with the different economic activities. So we are trying to balance and safeguard, as I've said, would be stricter lockdowns. We will be focusing on the different barangays, and we will be assisting the local governments in how they will be able to implement this code strategy or this active surveillance, immediate isolation, immediate testing, and management of these cases.
So if we look at the numbers, we are at 164,000 COVID cases. 3,314 cases were added Monday. What scenario, though, are you looking at or expecting now that we are on GCQ? Are you expecting, is the DOH expecting a steep rise in infections? Because if we look back at possibly the last week, we were averaging about 4,000 a day.
Yes, Pinky. Whenever we ease out on no, or we de-escalate these restrictions that we make, we expect that there would be cases that would be identified, no higher cases, as what happened to us when we de-escalated to GCQ in the past. But as I've said, we are setting safeguards, no, so that we will not be able to have this rise in cases again. So hopefully, these different strategies that we are now employing will bear fruit, no, and we will be able to avoid having these high numbers in the next couple of weeks.
So what kind of number can you expect or can we expect possibly with all these interventions in the next 2 weeks? Are you still expecting a 4,000 day average, or are you expecting this to significantly be reduced?
Well, hopefully not, no, that we will not have this kind of numbers anymore. But I cannot really say because we are just going to de-escalate tonight. We will see how the mobility of people will really contribute, no, to the rise in cases, or maybe we can avoid by doing the safeguards that we are saying. That's why the Department of Health is continuously calling on all individuals to be responsible enough to enforce or to comply with these minimum health standards so that we can avoid this kind of numbers in the future.
And it's good to talk about clustering because there's about 1,245 clusters identified so far, and more than 1,000 are actually coming from the communities. I want to talk to Yusek Vergeire about this, but we need to take a very short break. The source will be right back. You're watching The Source on CNN Philippines. Our guest today, Yusek Maria Rosario Vergeire. So I was talking about the clusters, 1,245 clusters identified so far. Majority of this, or 80, more than 80% possibly, 1,000 clusters are coming from communities. My question, Yusek, is what is the reason for this and what should be done?
Yes, Pinky, no, we have seen that these clusters are increasing, and most especially we are seeing that most of these clusters are happening in communities, in families, in households. When we eased on the restrictions, no, when we de-escalated to GCQ, we allowed the productive members of our society to go to work already. So this is one of the assumptions that we are looking at, that those people going to work when they get back home, they if and when no, they are infected, they transmit the virus to their family. So also another thing, there was
Hmm.
this observation that not all in our communities are complying with minimum health standards. We still see people without masks. We still see people talking with each other without physical distancing. So all of these things we are looking at, kaya po ganito, no? And another thing would be we have expanded our testing.
Mm-mm.
And this expanded testing, our local government units have been very proactive in doing this. So we are really seeing the numbers in our communities because also of this expanded testing.
And when we talk about testing, Senator Gordon was saying, please clarify this, USEC. Senator Gordon was saying there's 5,000 positive COVID cases who have not been informed of their results since or as of July 30. Ang sabi po niya, it is up to the DOH actually to inform the patients. Why hasn't, because Senator Gordon was saying this, the DOH informed these 5,000 patients that they are actually positive?
Pinky, even from the start of this pandemic, no, we have already issued guidelines wherein laboratories have that responsibility of informing the individuals who gets tested. And if the individuals got their swabs from the local government units will get the report from the laboratory. The laboratory is the turnkey. Laboratories would issue the results, the line list of both positive and negative to local government units, to the DOH, and to individuals. So it is the responsibility of the laboratory. So it is not really efficient if we are
Okay.
going to be the ones to provide the results to patients because it will take a long time and contact tracing will be delayed.
Very clearly. So it's up to the labs to be able to release these results. Just a quick question, Yusek, because I read that in Olongapo City, there are 16 doctors and 32 nurses, an ambulance driver, and a hospital helper now on quarantine. This is from the James Gordon Hospital because of their exposure to a COVID-19 patient who went for dialysis. Any plans from the DOH to actually assist this particular hospital in terms of staffing?
Well, there are plans. We have emergency hiring now. Actually, in the last 2 weeks, we had been expediting the hiring of healthcare workers. And also, we have added incentives to both public and private healthcare workers in this Bayanihan 2 proposal that we have for legislation. So these healthcare workers, we are now augmenting both in public and private. They just need to submit to the department their needs so that we will be able to assist them.
And last question, just on the case of Secretary Año, because this is being talked about and people are wondering, what do you know so far? Is this really a reinfection or it's too early to say that?
Yes, Pinky, it's too early to say that. We do not have enough evidence yet to say that there is reinfection. Even around the world and even international experts have not given recommendations or announcements regarding reinfection. What happened to Secretary Anyo? We have referred this to our experts in the DOH, and we are trying to study it right now. So there are three possibilities that our experts have provided. First, it might have been that these are remnants of the virus because RT-PCR is very sensitive. But since he has symptoms, we need to check the details in the laboratories, both from his first infection and now on his second infection, just to check the CT values. Now, this is kind of technical, but we are going to check these different details so that we may know if there was contamination, if really the positive case of Secretary Anyo now is accurate. So we will be giving information in the coming days.
Thank you, Health Spokesperson Maria Rosario Vergeire. Take care, ma'am.
Thank you very much.
And thank you for joining us here on The Source. I'm Pinky Webb. You're watching CNN Philippines.